a disconnection between the brain and the penis. This is how an erectile dysfunction patient described their symptoms to me. So if this sounds anything like what you're dealing with, then hang around, because I'm going to explain to you exactly why this disconnection happens and what you can do about it. If it's your first time here, welcome. My name's Luke. I am the lead practitioner at Men's Room Shockwave. We're a small clinic in Banstead, Surrey, and we treat a lot of men's health problems, in particular erectile dysfunction. A lot of the guys that come to see us are men aged 40 or over who are dealing with ED and essentially trying to find a way to resolve it without just having to take a load of medication all the time. So if you're looking for solutions outside of just popping pills and slowly seeing this condition getting worse, you're actually looking for something that deals with it at the root cause and can get you long-term good sexual outcomes, then yeah, you're in the right place. This video is going to be helpful for you. So this patient that I'm describing to you, who's in his 40s, described to me, and it really kind of resonated with me. And I was like, yeah, I'm going to do a video on that. I think it'll be helpful. But the way he described it to me was like, he said, everything in my brain is working. Like the arousal kicks in. He feels focused. He feels like he's in the moment. And intuitively as men, we know that that is then sending a signal down into the groin for something to happen, and that would be the response. So the penis, the erection, is the response to the brain. But he was like, it feels like a circuit break. It feels like there's a disconnection between these 2 points. And I thought it was really interesting and something that's kind of worth looking at, because there might be a bit of intuition into why that is, but we can get into, locally the anatomy there of actually why that's happening. Because there's a couple of different things which could be going wrong. And once you understand which one it is, then you can actually start to understand what you can do to fix it. And there are options to fix these problems. So firstly, it's worth saying that if you're getting that first bit in the head, you're getting the arousal, then this whole thing isn't a problem of testosterone in all likeliness, because testosterone is just going to limit the ability to get the arousal in the first place. So we can kind of wipe that away. It's also unlikely to be a psychogenic problem, because we would intuitively get a sense that this problem was in the head and that message wasn't being sent from there to there. But for everything to be working perfectly, but just feeling disconnected from the groin region, it's much more likely to be either the local blood vessels or the local nerves in and around the penis area which have got the dysfunction, okay? So if we go back to the messaging system analogy, we can think that message from the brain, this is a nervous system, is going through the central nervous system into the peripheral nervous system, okay? So that's basically like big nerves into small nerves, and then those nerves go all the way locally towards the penis. Now, the first thing that could potentially go wrong is a local nerve dysfunction, like a pudendal nerve dysfunction. When we see people with pelvic floor problems, okay, the pudendal nerve runs through the pelvic floor muscles, and if they are tight, then that could be the first point that circuit is essentially broken. The messaging system can't go from the central nervous system to the pudendal nerve and then into the penis to help with the erection, because it's being trapped in a tight muscle in the pelvic floor. Seems like an oversimplification of a problem, but this is how a nerve entrapment can happen anywhere. If you were to trap a nerve in your neck, you get pins and needles in your hand and potentially lose the function and lose the grip strength in the hand. It's the same process, okay? The nerve traveling through something, it gets limited, the signal can't get through, and then we get problems downstream from that. And this is exactly the same thing. So the first place where people are saying that there's a disconnect there could be that nerve just isn't working. Another thing which could be creating a disconnected feeling between the brain and the groin area for a man is the local vascular system, okay? So the blood vessels in the penis have to essentially dilate. There's a process which goes on with that. It's a nitric oxide process. And the end point of it, as most men know, is that when the blood vessels open, that's what the erection is. But you could have the message going from the brain, fine, through the central nervous system, through the pudendal nerve, fine. And then once that local blood vessel system, that vascular system, is triggered to begin to respond, that's where the dysfunction could lie. And that would then create the same kind of feeling that, okay, I'm in the mood, everything's working, but once that message gets to that point there, something then just isn't happening, and that's what leaves you feeling disconnected. The vascular system is so important with erections, like we've just said, like an erection is blood flow. But the problem can be sometimes the vascular health, so the actual blood vessel health. Anyone that's got a history of high blood pressure or a history of diabetes is likely to have some damage to these blood vessels. It's a microvascular system, and they are more likely to get damaged than other blood vessels. So they're kind of the first to go. So if we get some damage to that vascular system, then it could be that that message is getting sent, everything is normal, but when we get there, the actual endothelial tissue, the actual blood vessel itself, hasn't got the capacity to open. There's certain smooth muscles there that just do not have the ability anymore to open up and dilate and maintain that dilation for the erection. So that could be the local problem, is it's essentially just some damage to those blood vessels, which typically happens with people as they get older, but usually there is some kind of health implication like diabetes or high blood pressure. So in terms of what you can do about it, there are two completely different treatments for those different causes. And a good practitioner like myself is going to be able to notice some signs as to what is the cause of the problem, okay? If you've got a problem with that pudendal nerve, we're not going to prescribe you shockwave therapy because it isn't going to do bugger all for the nerve. And the same, we're not going to give people nerve stimulation if we think they've got a blood vessel problem. So we work with local GP surgeries, and essentially urologists send us patients too, and we make sure that we've got the diagnosis sound for our patients. Is this a nerve problem? Is this a blood vessel problem? Is this a pelvic floor problem? And then we can give you the right treatment. So if we've got a nerve problem, the first thing we're going to be saying is why? Is this purely a nerve entrapment at the pelvic floor? If it is, then we've got a treatment plan for that. We've got stim pod therapy, which is neuromodulation, and essentially we would be able to stimulate the nerve to start to improve its function. And then we would be looking at the pelvic floor, trying to reduce the tone in the muscles, which we use shockwave therapy for. And then we would give you exercises, try and reduce the tension in the muscles. And then we would build up strength in that area afterwards and rehab it like that. That is a really effective treatment plan. It's one of our shorter treatment plans for erectile dysfunction. If this was a nerve-related problem that was related to nerve damage, so like peripheral neuropathy, so like a diabetic patient's getting erectile dysfunction, usually there'd be some signs of nerve damage, like loss of sensation or something like that in the penis, as well as this disconnected feeling and the ED. Then we might not actually need to do any shockwave therapy, and we're just going to be stimulating that nerve. It's going to be a slightly longer treatment plan of nerve stimulation, but essentially every time we stimulate the nerve with the neuromodulator, the function of the nerve can improve and improve. And if we keep going, it will compound over time, and the function of the nerve will eventually go up and up and up until we start to see improvements in the sensation and improvements in the erections. If we think we've got a problem with the blood vessels, then we're going to be looking at shockwave therapy, because shockwave therapy creates a little bit of micro trauma. Don't worry, it's not painful, but the body senses it as a little bit of micro trauma to the area, and then the body comes to heal itself from that micro trauma. And it's within that healing response, if we localize it to where the blood vessels are, that we can actually create a little bit of a healing response where those blood vessels are to improve the function of the blood vessels. And even over time, the body can be triggered to grow brand new blood vessels in a process called neovascularization, which, if we think we've got a vascular problem, a blood vessel issue, and we trigger the body to grow brand new blood vessels, that's a really great way to reverse erectile dysfunction. So I hope this helps, and I hope conceptually we kind of understand what I'm talking about in that sort of disconnect. If it does sound like you, and you're thinking that one of these two causes of erectile dysfunction, might fit your symptom picture, pop onto our website. There's a free download on there, which is our shockwave therapy info pack. It's got a little bit of information about nerve stimulation as well. It's just a nice place to start to have a little bit of a read about what your symptoms, might match up to in terms of treatment, how treatment works, and you can just kind of start the process there. There'll be a link to our website below. But yeah, hope this helps.